This patient was referred to me 3 years ago for endodontic treatment of tooth number 21. You can see there's a periapical lucency right there. What's going on there? This is another angulation of the tooth. You can see there is resorption, root resorption here, and take a look at that periapical lucency. Comes up laterally as well. You can see that right there. And there was also a sinus tract associated with the tooth right there. That's the tooth right here, buccal sinus tract right there. So we discussed options with the patient. The patient said she wanted to try to save the tooth. So we did the root canal in one appointment. When I see something like that, there's no way I use gutta percha. I know that gutta percha will not seal this canal properly with this type of resorption. So my plan is always to go ahead and use MTA. If placing MTA is possible, I use MTA. And here's the date, as you can see, 6/10/2020. And this is immediately after we did the root canal. Again, placed MTA here. We did this in one appointment. I got a gap here. Is that going to cause endodontic failure, this gap? And by the way, I filled the entire canal with MTA, and there's a gap. There's a gap in MTA. And here's the date, as you can see, 3 years ago when we did this root canal in one appointment. And again, this whole thing is MTA, and there's a gap here. And there's some MTA extrusion. Is MTA extrusion going to cause endodontic failure? Is this gap here between MTA going to cause endodontic failure? Is one appointment root canal, we did this root canal in one appointment versus multiple appointments, is one appointment root canal treatment going to cause endodontic failure? Let's see. Again, here's the date when we did the root canal 3 years ago. And this was just now. Patient came in to see me for a different tooth. We took a PA of tooth number 21. As you can see, that large periapical lucency that extended laterally up healed completely in 3 years. Okay, so 3 years post-op of tooth number 21. You can see this was just now today. And this is intraorally today. As you can see, the sinus tract is healed completely as well. And oh, where's the date? Right here. So 3 years post-op of tooth number 21. 3 years ago, pre-op, you can see the large periapical lucency right there. And today, zoom out, pre-op 3 years ago, today. So gap in the filling material doesn't cause endodontic failure. If you extrude MTA, doesn't cause endodontic failure. One appointment versus multiple appointments. We did this root canal in one appointment. Doesn't affect the outcome. All of those stuff that you were taught, perhaps, just throw them away. Throw them away. They're nonsense. So 3 years ago today. Huge periapical lucency. And today, 3 years later, healed completely.